The most common area patients will come into my office and complain about is their trunk. And it's actually a good thing because that is the area where they typically will get the biggest bang for their buck when they do something to address that. We first address the front because that's where the bulk of the changes will initially begin. They have separation of the stomach muscles, they get loose skin in the front, and then what I want to look at is where does that laxity end, or does it? And if it doesn't end and it continues to wrap all the way around the trunk all the way back into the middle of the back, we'll typically see that the outer thighs have sagged, the inner thighs have sagged. So we've got to start thinking about more advanced ways to tackle that. It's a circumferential excision of tissue with a lifting that is performed all the way around. So what we're able to achieve is that nice tight pull on the outer thigh. We elevate and lift the buttock area, and I'll actually even see quite a tightening in the pubic area and the inner thighs. The average for most people, I would say, with an abdominoplasty is going to be about 2 weeks for desk work, and for the lower body lift, I tell them at least 3 weeks. But we're taking that trade-off that our scar might not be as thin as we'd like it to be in order for us to get the excellent contour that we're after, but very manageable. A lot of options after the fact to try to address the scar if we end up with a scar that's unappealing. It really is such a profound change in their life that it just opens up so many new doors to them when it comes to activities and clothing and how they dress and what they do, that it's pretty hard to compare that to any other procedure when it comes to the transformation that those patients will see.